Hi, everyone. Welcome to week 4. I just wanted to talk a little bit about last week, this week, and our assignments and the quiz from last week, a little information about frequently missed quiz questions. So last week we were looking at HIPAA specifically, privacy and security regulations, looking at privacy and security breaches, those types of things. This week, and like I said, we're going to kind of go back and forth between law and ethics and law and ethics. This week we're going to head back over to the ethics side of the house a little bit, looking at medical ethics and different types of pressing medical issues that we face in the healthcare setting. So let's hop over to our quiz questions. Let's see, present, there we go. So this week, first question, Health Insurance Portability and Accountability Acts, or HIPAA, H-I-P-A-A. I find that people have a tendency to put H-I-P-P-A, I think just because of the way it sounds, but HIPAA is H-I-P-A-A, provides that, and then obviously we have several answers here. The correct answer was all of these are correct. So the first bullet, patients must be able to access their record and request correction of errors. That is true. The provider does not have to correct an error in the record. It is up to providers. Sometimes providers will put information in the record that the patient will disagree with, but the patient is not the provider. So a patient can request an error correction. Like for example, my husband had some testing done. He got the report of the test and it showed that he was a female. So he requested that correction. And those types of errors, typically providers are willing to change. But sometimes there is commentary in a medical record that is the provider's view of the patient's situation, their condition, whatever it might be. And sometimes patients don't, they're not pleased with what's written in the record for whatever reason. And providers don't have to make changes when the information is factually accurate in the record. Next bullet, patients must be informed as to how their personal information will be used, and that is also accurate. When you go to a physician practice or a hospital for the first time, you will be given what's called a notice of privacy practices, and that notice will detail how your personal information will be used. So, and you will actually have to sign off on that in some way, typically a form, or if it's a place that really is electronic, you may sign off on it through the patient portal. But they do have to provide that to you, and if they ever make any changes to those policies, then they need to provide those changes to everyone as well. So very detailed what's required under HIPAA. Patient information cannot be used for marketing purposes without the explicit consent of patients. And that is also true, but what that explicit consent is typically obtained through the notice of privacy practices. So when they send you that, or when you come for the first time, they give you that notice. It'll detail in there how they plan to use your information for marketing. And then when you sign off on it, that is you giving your consent. Most notices of privacy practices will give you the option to opt out of marketing. But I don't think a lot of people even pay attention to it, and they just move forward. So that is also accurate. So our answer here is all of these are correct. Next question. The integrity and completeness of the medical record are important in reconstructing the events surrounding an alleged negligence or criminal act in the care of a patient where the medical record, and again, the correct answer here was all of these are correct. So it can aid in police investigations, it can aid in determining the cause of death, and it can provide information in work comp cases or personal injury proceedings. And because this is all crucial to those situations, that record needs to be complete and the information needs to be factually accurate. And that's what integrity is about, having good information, good, accurate information in the medical record. So all of those are correct in that instance. Next question. Which of the following statements is true regarding medical record entries? So the two there at the top, they should be written within 7 days or 21 days. Those are not, there's no timeline. Actually, the suggested timeline is as soon as possible, typically that day or maybe the next day of medical record entries. So it's always suggested that you do entries in the medical record as soon as you're able. Not providing too much clarity, that's certainly not true. We want to make sure our record is very clear and able for providers other than the one that is doing the documentation to be able to understand, so that's not accurate. The accurate answer here is they should be legible to read. And so you may think, well, when is someone going to be handwriting in the record? But you'd be surprised, especially in the hospital setting, how many forms and whatnot are still handwritten and then scanned into the electronic medical record. So just be aware of that. You always want to make sure that information that goes into the record is legible. And as someone that used to audit records, used to audit progress notes and office visit notes and those types of things back in the day when almost everything was handwritten. Legibility is a huge issue in the industry, so that's gotten a lot better since most notes and whatnot are now. They're typed or dictated and then transcribed, but there are still forms and whatnot that are filled out by nursing staff, by providers, etc. And it's really important that they are legible. So that's that. Let's hop back over to the classroom. So, like I said, this week we're going to talk about ethics. We're going to flip back over to discussion of ethics. You have some reading. Obviously, you're reading in the textbook. We have an assignment that is a written assignment that's based on this video here. Unfortunately, I can't embed the video in the classroom. You should be able to click that and it would take you over there. But it's a video about stem cell fraud. And then we also have some other stem cell information up here in the readings for the week. So you'll want to look at all of that and talk about what the situation that occurs in the video and what happened to that family, and the use of stem cells overall, and how the ethical dilemmas associated with that. We also have a discussion board, a typical written discussion board typed out in the classroom, and we have two different. And actually, I don't see the John Q trailer. I'll have to pop that in here. It usually comes over here with the discussion board, so I'll add that. But so for your discussion this week, we have some information about Christian Longo and his dilemmas with regard to donation of organs, and that's this last article up here under the readings. And then also the trailer for the movie John Q. And if you've seen John Q, you won't need to watch the trailer necessarily, but if you haven't seen it, it's a great movie. Denzel Washington about his son being refused a transplant, a needed transplant, and then what occurred after that. It's not 100% accurate to what would typically happen, but it's a very powerful movie. So if you're looking for something to watch, it's an interesting one, and I'll add the link to that trailer up here as well. So a couple of items to discuss, both regarding organ transplantation. So one is as a donor and one is as a recipient, and your thoughts on those. So, and then the assignment, like I said. We have our quiz, our ed puzzle. This week on Wednesday at 7, there is a midterm check-in. It's not a requirement. You don't have to come. There's no points associated. But I will hold a live class where you can come if you have questions, want to review something in more detail, etc. So don't come and expect a presentation or something of that nature. That's not what we're going to do. But if you have questions, or if you want to just come and hear others' questions, if anybody has any, we will be doing that on Wednesday at 7 o'clock. So, and I guess that's it. So any questions, please let me know. I'll look forward to seeing folks on Wednesday if you're interested, and I will see everyone in the classroom. Thanks.